So in order to synchronize this, many patients may not be able to take directly the inhaler, or sometimes we advise patients to use, even if you know how to do it properly, use what is known as the spacer. So this is called spacer device. It is a holding chamber for the medication inside. The deposition of the medication from the inhaler into the lung is far superior when you use the spacer. So this is how the procedure, this is how the spacer with the inhalers are used. This is the spacer, and shake well thoroughly and put it inside snugly. Then remove this cap which is there. Remove this. Then again sitting upright. Okay. So first breathe out slowly. Inhale and hold your breath. So you have enough time to inhale now. You don't have to do it in a hurry like using it directly. And hold it inside your chest as long as you can, or count 1 to 10 and then slowly breathe out. One puff. So sometimes doctors also advise you to do 2 puffs together inside. That is also okay, but this is the best way to do it. And common mistakes which are done are generally, again, not shaking thoroughly the inhaler or the canister. Also not locking these. It comes in 2 parts. You must snugly lock this 2 parts of the spacer device, number 2. And number 3, also not breathing out. You must breathe out slowly and do it. And the other important errors which are done is to inhale quickly, like this, like that. You should not do it. You can do it because there is a holding chamber. The spacer is there to take the inhaler. So there is enough and plenty of time. Don't do it in a hurry. Always do it in a relaxed condition. So then you can inhale slowly, not quickly like this, like that. And then the second one can be repeated after a gap of 1 minute or 2 minutes, doesn't matter. The inhaled corticosteroids which are commonly used in asthma management, which needs, after taking the inhalation, you must gargle or rinse your mouth with water, whether it is after the spacer device or after taking it directly. You must gargle your throat or rinse your mouth thoroughly with water and then leave. The bronchodilator, which is salbutamol, generally does not require any kind of gargling the throat or rinsing the mouth with water. So that is another important thing. Also to keep the spacer clean and hygienic, because you are using for yourself, so don't worry about it. At least 2-3 times, at least 2-3 times a week, or at least once or 2 times a week, you must clean this with plain tap water. You don't have to do anything. You can put soapy water and clean thoroughly, and then air dry it. Dry it with air. That is one. And also to replace the spacer once in 6 months. That should be okay. And always close this so that you don't get anything going inside, so it becomes hygienic.